Hello, ladies. Hope you guys are having a wonderful day so far. I know it's been a busy day for me. Wednesdays always seem to be busy, but here we are again, meeting. Let's see, just making sure I'm all connected, making sure, can everybody hear me and see me okay? I think we're good. All right. So nice to be with you again. We are going to be discussing a topic tonight that is, I mean, it applies to so many. The majority, the vast majority of my patients, this affects in some way or another. So we're going to, as we wait for everybody to jump on, I am going to say my disclaimer here. So let's do that. Anything that I say tonight during this Wellness Wednesday is not specific health advice, but it's intended as health information only. Do not start taking or stop taking or change the way you take any of your medications. And please consult with your prescribing practitioner if you feel like you need to do so. Also, attending this Wellness Wednesday does not establish a doctor-patient relationship. Okay, so I want to introduce this topic of steatotic fatty liver disease. And the word steatotic is very, very medical, right? And they wanted to, it's a very recent change, actually, to that term. I mean, it's been a term certainly in the medical community, but they wanted to change fatty liver disease to something that I guess was less offensive, but let's face it, it describes the same thing. So the reason why this is so important, you guys, is that 40 million Americans are diagnosed with non-alcoholic fatty liver disease. I'm still going to call it that. It's too hard for me to remember to call it steatotic liver disease. So just bear with me on that, okay? 40 million Americans with non-alcoholic fatty liver disease alone. That doesn't account for all those that have alcoholic fatty liver and those who have not yet been diagnosed, for the simple fact, and I'll bring this up later, that there's really no medical treatment for this disease. Okay, so that's why this is so important. And it seems to come as a symptom. So get this, a symptom of underlying conditions, including hypothyroidism, right? So and another very important condition, diabetes, right? So basically what happens with fatty liver is you get, and all of our organs do have our abdominal organs do have some degree of fat that surrounds them and is incorporated sort of with them. And so really what happens is when liver cells die, and I'll get into that in a minute too, why that happens. They get incorporated into the fat, and the fat tends to then infiltrate or kind of project into the organ, the liver. And as that happens, it can swell, right? Fat tends to swell. It's not that the cells, and our fat cells don't necessarily multiply unless you have certain conditions where they do. What happens is they swell, right? And so the more fat they absorb, or the more sugar that is put into the fat, makes those fat cells expand, and this starts to break apart the liver. And it's interesting that if you study real in depth what the liver looks like on a microscopic level, there are groupings of cells within the liver, or pods, kind of cell pods, with where the liver cells surround the bile duct, and then the bloodstream comes in from your body to deliver toxins, right? Because that's how what our liver does. It takes care of a lot of things for our body, and one of the major things that it does is helps us to detox our bodies. So as cells and organs and tissues are able to get the toxins out into the lymph system, into the blood, that's going to be the route. Then from there, the blood comes into the liver. All of our venous blood comes into the liver, all of it, and then it gets cleaned up. Right, the liver does its job to clean it up, and so surrounding these groupings of cells around the bile ducts are these blood vessels that are then, our liver cells have the job of taking the toxins out of the blood into the bile. And it's a very involved process, lots of biochemistry happening there, lots of, different phases of detoxification. It's a mess if you look at it from a biochemical perspective. But it's amazing. It's so miraculous that this happens. Anyway, so there are, when the fat infiltrates the liver, and it can break apart these cellular pods, these cell pods, or groupings within the liver that make it so you don't do the liver doesn't do its job as well as it should. And it's interesting. I've read a lot, studied a lot about fatty liver, and it almost always seems to say, now this doesn't tend to cause, a little fat in the liver doesn't tend to cause a lot of problems for most people, except it doesn't take much for that fat to really develop. All right. And I'll get into that a little bit too, a little bit later. All right. So there are different types of fatty liver disease. Metabolic dysfunction associated steatotic liver disease, MASLD. My goodness, that's a mouthful. They previously referred to this, healthcare providers used to call this non-alcoholic fatty liver disease. All right, because the steatosis, or the fat development, isn't associated with heavy alcohol consumption, so non-alcoholic. So experts again rename this condition to really reflect what the fat buildup in your liver is associated with. So with MASLD, the culprit is cardiometabolic risk factors. So these factors include conditions and characteristics which pose risks to your heart health, like obesity, like diabetes, high triglycerides, high blood pressure. Okay. All right. But then there are other conditions that are risk factors for this. So polycystic ovarian syndrome, obstructive sleep apnea, hypothyroidism, and hypopituitarism, which is low pituitary gland hormones. All right. Hypogonadism, which would be low sex hormones. And then if certain medications can certainly be involved in this metabolic associated steatotic liver disease, MASLD. So amiodarone, this is a common heart medication for arrhythmias. Diltiazem, which is for blood pressure. Tamoxifen, which they give you if you've had breast cancer and and the cancer was estrogen receptor positive, or steroids. These types of medications. So hydrocortisone, like you get in with shots in your joints, or if you take that for autoimmune conditions, for really cutting down on the inflammation. That's the medical go-to for treating diseases that really there is no really no other treatment where the immune system is really a mess. So this can be a side effect of these medications, this fat buildup in the liver. All right, so metabolic associated steatohepatitis, that's a mouthful too, MASH, M-A-S-H, again, used to be known as NASH, all right, so non-alcoholic related steatohepatitis. It's even hard for me to say. With MASH, fat buildup progresses to inflammation, then tissue damage and scarring, fibrosis. Okay. All right. So another type then would be MASLD and increased alcohol intake, and they call that MET-ALD. So with metabolic alcohol-related liver disease, both metabolic risk factors and alcohol consumption play a role in fat buildup in the liver. There are certain thresholds for alcohol consumption amounts for males versus females as well. It takes less for females than it does for males. And really, which contributes most, the metabolic side or the alcohol side, really varies person to person. There's really no way to know. Now, alcoholic-related liver disease, with that fat buildup in the liver or steatosis, occurs because of excessive alcohol consumption. Each time your liver filters alcohol, some of its cells die. I don't know if you knew that, okay? Every time you drink some alcohol, some of your liver cells die. Usually, your liver can make new cells to replace the old ones, so there isn't, a huge problem. But if you drink too much alcohol, and again, that will vary person to person, your liver may not be able to keep up with making new liver cells versus those cells that are dying. And then again, those dying liver cells lead to more fatty buildup. So that's when this steatosis, this is the new vocabulary word today, right? Steatosis, when that can set in, okay? Now, causes of fatty liver disease include lifestyle factors like diet, alcohol consumption, etc. But let's talk about like eating too many calories, especially calorie-dense foods and not exercising enough. So this is always part of the equation, but it's not, again, always good to exercise too much. And I talk a lot about that in the master class that's coming up. So I'll talk about that too. Eating too many carbohydrates, right? Eating too many bad fats, saturated fats that are artificially saturated, protein, too much protein from meat. Eating too much meat can lead to fatty liver buildup or fatty buildup in the liver. There are genetic factors as well. There are a couple of gene variants. You can look these up on Dr. Google. I forget what they are at the moment, that relate to fat metabolism, inflammation development, and oxidative stress pathways that have been identified. These increase your risk for non-alcoholic fatty liver disease in lean individuals. There are also genes determining how your immune system will handle biotoxins that can also cause inflammation stress in the liver, leading to fatty buildup in the liver too. And certainly underlying health conditions, and I want to focus some on this stuff. Insulin resistance, hypothyroidism, obesity are the most common. So I'll get into those in a minute. Steatotic liver disease doesn't always cause symptoms. So when they are present, they might include abdominal pain, maybe a feeling of fullness in the upper right side of your abdomen or stomach, your belly, extreme exhaustion or weakness, fatigue, right? Now, I don't want you to worry too much about these symptoms because they're common in so many other things, but more commonly people notice symptoms once they actually have progressed to cirrhosis of the liver. So when cirrhosis develops, you may experience nausea, loss of appetite, unexplained weight loss, yellowish skin and eyes. So that's known like whites of the eyes. That's called jaundice. Swelling in the abdomen, like really, gets really tense and big, and it's known as ascites. Swelling in your legs, feet, and hands, so edema in those areas. Bleeding that say your provider might find in the esophagus, or because maybe you've complained of coughing up some specks of blood or something like that. I know this sounds really awful and scary, but it's good to know what to look for. Maybe even in your stool, blood in your stool. Okay, so what is the overall impact of this disease? Like I said before, looking at the numbers, 40 million Americans diagnosed with non-alcoholic fatty liver. So many die yearly from alcoholic fatty liver disease as well. And really, because there is no medical treatment, the thing doctors test, they might test for it, but if they find it, it's just a watch and wait kind of a thing until you are, really looking like you need a liver transplant. And so it's quite disheartening for many who are unaware that there are many things that you can do to actually reverse this disease process. And because there are so many things you can do to change your lifestyle, and there are helpful things to do for fatty liver disease to help reverse it. So we'll get into that too. In some cases, liver disease develops, which starts with hepatitis. That's where your liver goes from fatty to inflamed or swollen. And so the inflammation damages tissue. And this stage is the steatohepatitis that I mentioned when this happens in MASLD, which becomes MASH, or metabolic associated steatohepatitis. This then progresses to fibrosis, which is really is bands of scar tissue that form where the inflammation damages your liver, causing it to stiffen. So this process is known as fibrosis. Cirrhosis is extensive scar tissue that replaces healthy liver tissue. And so at this point, you have cirrhosis of the liver. And without treatment, cirrhosis can lead to potentially fatal conditions, so liver failure and liver cancers. All right, so let's talk about fatty liver and insulin resistance. So just briefly, insulin resistance is when your cells, mostly the organs and muscles and other lean body tissues like bones and some other, again, connective tissues, are not able to utilize insulin to allow glucose into the cells for fuel, to be used as fuel to produce energy. So when this happens in the liver, your liver cells are not able to do certain things. So the link between fatty liver disease and insulin resistance is this. Insulin resistance causes fatty deposits directly by increasing what's called de novo lipogenesis, or new fatty buildup. Okay, that's the fancy word for that. In other words, insulin stimulates enzymes that cause more fat to form, or those fat cells to swell. Insulin resistance indirectly causes fatty liver disease by impairing the ability of insulin to suppress the breakdown of fat, or lipolysis. So insulin's main job is to store fat, right? That's what it's supposed to do. Well, this also happens in the liver too. So when your liver cells aren't able to use insulin, well, insulin is going to then take the glucose that isn't getting put into the cells of your liver to help them function properly. Well, it puts that glucose into the liver fat because adipose tissue, fat tissue, becomes resistant last to insulin. Okay. First, it's the organs. And actually, the liver is one of the first places that your body develops resistance to insulin. And so it's so important to find the causes for insulin resistance to be able to turn this around. Okay, so when you have, when insulin is unable to suppress this, this fat breakdown, lipolysis, this leads to increased delivery of fatty acids to the liver. And then this increased fatty acid concentration then may even cause worsening insulin resistance in the liver. So it's kind of a catch-22. The increased free fatty acids cause hepatic insulin resistance, liver insulin resistance. So managing insulin resistance then is so important, and it's not necessarily about giving drugs to manage it, because frankly, the way doctors treat insulin resistance and diabetes, type 2 diabetes, as that progresses, for medications like metformin, the way they do this, what metformin does is it actually stops the liver from kicking out glucose into the bloodstream, because the liver doesn't want that glucose hanging around to basically do its damage and inflammation that it can cause by hanging around the cells that it can't get inside of. And then, of course, the insulin puts that glucose into the fat. So in many respects, metformin actually contributes to liver disease and causes fatty buildup ultimately in the liver. Like, this is nuts. Why don't doctors recognize that the gravity of these side effects of these medications? Hypothyroidism and fatty liver disease. Researchers have discovered that hypothyroidism may cause fatty liver. This is known as hypothyroidism-induced non-alcoholic fatty liver, oddly enough. People with hypothyroidism tend to have higher levels of total cholesterol and LDL cholesterol. They may also not be able to move triglycerides out of the body as quickly as people without this condition, right? So triglycerides then build up, and that is a sign of fatty liver disease. All right, as a result of that, hypothyroidism may cause fatty buildup in the liver due to rising levels of LDL cholesterol combined with triglycerides in the liver tissue. So when the fats accumulate in the liver, they cause oxidative stress and inflammation. Well, this process that I described that causes the steatohepatitis. So this is interesting too. The hormone leptin, many of you may have heard about leptin, is another factor in this equation. So leptin tends to be elevated in people with hypothyroidism and people with non-alcoholic fatty liver disease. So this hormone may cause insulin resistance in the liver. So it's thought to be part of that mechanism and lead to the liver injury or fibrosis. Okay. So there are some labs that really help us to evaluate you for the presence of fatty liver disease. So, of course, liver enzymes. We're talking about AST and ALT. We're talking about alkaline phosphatase. We're talking about um, lactate dehydrogenase. We're talking about uric acid. Uh, also, um, insulin, blood sugar, A1C, right? All of these tests are very, very important for really helping us to understand if there is, fatty liver, triglycerides, obviously LDL, these markers that are in all of our blood labs, right? Um, actually mean something, and even if they're normal, in normal range, because if they're actually outside of the optimal range, then we can catch this early. The point is to do these diagnostic tests in this setting to be able to catch this early, because these will show up well before you'll see signs on scans, on ultrasounds or CT scans. There is a scan that is called FibroScan that helps to really, and it's a quite sensitive ultrasound to see if there's fat developing in the liver. But really, if it's not like super, if it's not progressed enough to show up larger, it's going to be easy to miss on those types of tests. So we look at really getting comprehensive testing to help us understand whether you are heading toward fatty liver. And then we've got to stop that freight train from moving any further down the track. All right. So let's talk about some options, lifestyle treatments and options for, treating fatty liver disease and helping it to reverse. So obviously dietary changes. You've read, probably a lot of you have read about the Mediterranean diet, low carb diets, and certainly these are very helpful. I explain a lot more about, why it's important in the masterclass. I explain a lot more why it's important to really customize this. So it's really not possible for me to say, look, you definitely need to eat this way in this setting. Of course, like I said, I'm giving you information, health information, and not health advice anyway. But it would be really difficult anyway to tell you exactly what you should be eating in this type of a setting, because I don't have information about you based on comprehensive testing. Okay, so physical activity. How can you, what kind of exercise is typically most important for helping to burn fat and switch to that, that mode if you're having trouble with this? So zone 2 exercise is probably the most important thing you can do, other than some weight-bearing exercise as well. But really the ability, your ability to exercise may be quite decreased depending on what other problems you're having with energy production and stress and all that good stuff. So we delve really deep into this in the master class. So now the use of supplements certainly is important. There are multiple supplements. I'm sure a lot of you have, about supplements that are good for the liver, like milk thistle and omega-3 fatty acids and alpha lipoic acid, and there are many that are so helpful. But it really, again, I hesitate because I don't want you to go out there and just start taking stuff that you don't know is really what you need. So just know that there are helpful supplements that can help your liver handle some of this much better and turn around the insulin resistance and so forth. Okay, so obviously it's really important to manage stress and get adequate sleep, because if you don't get adequate sleep, you will develop more and more insulin resistance with not managing stress appropriately, not getting enough sleep. And so you're basically moving yourself forward down the track, if you have fatty liver, further if you do not address these factors. And I cannot stress enough the importance of individualized care based on proper testing to evaluate these risk markers and lifestyle factors. This is essential. It's so important to learn what's causing fat buildup in your liver and get treated. So even if you have early stage cirrhosis, there are steps that you can take to protect your liver from further damage. So in some instances, you can even reverse this damage by following, your provider's treatment plan for you that must be customized. All right. So I knew I had a lot of information for you today. Really just to conclude and recap some key points before we may get to a couple questions. There are several different types of fatty liver, right? And this, no matter what the causes are, if this progresses to fatty liver disease and cirrhosis, this is unfortunately a common cause of death, and it can be avoided. That's the good news, is it can be avoided, especially with early detection and proactive, health management. There are lifestyle changes to be made. There are supplements to take. There are tests to really find out what's going on early on, so that these steps can be taken successfully. So, and most importantly, would be, for you to really seek out someone who can customize a care plan, a treatment plan for you to help you through this complex problem. Because like I said, if you're dealing with hypothyroidism and I go into the master class with all the different patterns that there are for how you can be low thyroid, insulin resistance, and I'm going to talk a lot about that during the master class coming up. Honestly, it's so important for just to be proactive and get the information that you need about your body to be able to take care of this. So I will, during the class that is coming up on June 10th through the 14th, I'm going to deep dive into hypothyroidism and Hashimoto's, weight loss resistance, and certainly the role that insulin resistance plays, which is huge in all this, how it all works together, and what you need to know, why you need to avoid believing that it's all in your head, that's related to your age, or just accepting this as your new normal. I'm going to also explain why you still have thyroid symptoms despite having normal test results. The number one reason you're still stuck, despite trying everything, and a step-by-step thyroid blueprint that has worked for thousands of women just like you. I really want you to be able to move beyond the thyroid, lab numbers with actionable steps so that you never fail again. All right. All right. So let's go through some of the questions that you have. Oops, that was the wrong thing on my phone. So if you're insulin resistant, does this mean you should avoid alcohol? So yeah, I mean, if you are resistant to insulin and you have it on good, information that you are developing fatty liver, adding alcohol to the mix is just going to make that problem worse. All right, so fat in the liver is the same, but it just comes from different causes. That's right. So there are different causes for fatty development in the liver. And that's why we have to find out what it is that's causing it so we can fix that for you. Okay, and then what about dandelion tea? Yeah, I mean, that's a great, dandelion tea is really good for your liver. It's in small enough concentrations, low enough concentrations in tea form that, yeah, I mean, most people are able to handle that okay. I always want to choose organic. Okay, so I think that wraps up the questions. All right, ladies, once again, June 10th through the 14th for the masterclass. That's 7 p.m. Mountain Time, 8 p.m. Central Time. I'm going to be sharing all those things I just discussed and so much more. All right, I'm super excited to see you all there. Can't wait. So thank you all for attending this Wellness Wednesday tonight. Uh, I want you to remember that there are answers. You do have, you should have hope, and uh, your body always has the ability to heal. And I want you all to remember that. All right. Take care, everyone. Have a great evening, and we'll see you soon.